All right. So mental health conditions. We have autism spectrum disorder. We have borderline personality disorder. We have depression, dissociative disorder, eating disorder, obsessive compulsive disorder. We have post-traumatic disorder. Post-traumatic disorder. Let's say, for example, we have people who suffer from such kind of a condition whereby, let's say somebody was serving in the army, okay, and he was serving in the area of bombing, isn't it?
Yeah.
You know, loading those cannons, isn't it?
Yes.
So there's usually it's characterized by a big round, isn't it?
Yes.
Noise. Now, when they tie in the army, such people may suffer from post-traumatic what? Post-traumatic experiences, whereby when somebody is sleeping, then he has those like hallucinations, you know, and start throwing hands and shouting, you know, the post-traumatic disorder. Or somebody who have had, let's say, like past experiences, you know, let's say you're in a house that was bombed, and then you happen to escape from being hurt, isn't it? Though you physically you're not hurt, but what happens? You keep on, every time you hear that loud bang, something tells you it's the same thing happening again, isn't it?
Yeah.
And some people who have such kind of experiences, you cannot take them to a firework experience, isn't it?
Yes.
Where there is that loud bang and those traumatic disorder may affect them. We have schizoaffective disorder. So when we look at this condition one by one, what are the symptoms? And we start with attention deficit disorder, ADHD. What are the symptoms? They can easily be distracted. They are bored with the task easily. That means if you keep them in a living room to watch television, within a short time they are tired. They are calling you, they want something else. They cannot complete tasks quickly. They also have difficult in focusing attention or completing a single task or activity. They have difficult in completing tasks or projects, you know. They have problem in attention, in listening or paying attention when spoken to. They may be daydreaming. They may be daydreaming or withering with lack of motivation. They may have difficult processing information. So that's why the writer is saying that when you're working with these people, work with them with compassion. Know that they will not behave in a normal way just like another person may do what? May behave. Hyperactivity, they do forgetting, screaming, trouble sitting still. They have non-stop talking, touching, or playing with everything. They have difficult doing quiet tasks or activities. Impulsivity, they also have problem with impatience. So if you tell them, okay, they ask for coffee. You know the process of making coffee, isn't it? They don't, though you told them and you assured them that you're bringing coffee, then they cannot be able to wait for you to make coffee. So they have difficulty in acting. They can act without regard. They don't care what are the consequences when they do something. Blurting things out, difficult taking turns, waiting or sharing, and they can also interrupt others. All right? What are the causes of attention deficit hyperactivity disorder, ADHD? Genetics may cause high risk of developing ADHD, which runs in families, traits in specific brain areas, and contribute to attention. Environmental factors such as cigarette smoking, alcohol use, and during pregnancy or impulse to read to a child may lead to increased likelihood of child with ADHD. All right, what are the treatments? Treatment plans are effective when tailored to an individual needs. So that means every client has their own way how their treatment is tailored. Behavior therapy can help, okay? Elimination of diets to determine if food allergies, sensitivities, and play role in severity of the symptoms. There are also medications, neurofeedback, egg feedback, nutrition supplements. These are some of the ways that you can treat attention hyperactivity disorder, ADHD. The other disorder is anxiety. Occasional anxiety is normal. Do you have anxiety sometimes? Hello? Do you have anxiety sometimes? Yeah? There is the fear of there's the fear of unknown, and there is the known, isn't it? Yeah. And you could be having an anxiety that when I finish this course, am I going to get a good job with good pay? Isn't that anxiety some kind, isn't it? Yeah. Or you have done an exam and you're waiting for the results, isn't it? Yeah. You can have anxiety.
So it's a normal part of life.
Occasional. That's what you're saying, occasional. But this kind of anxiety we're talking about is a feeling of worry, fear of a real. There could also be perceived threat, isn't it? There's the way you feel. Anxiety can interfere with the functions of normal daily life and also affect the relationship. Okay? So anxiety disorders are the most common mental disorder in America. In 2015, the estimated 18% of adults in the US had anxiety disorder. Symptoms of anxiety disorder can become chronic and debilitating if not treated. What are the symptoms? Symptoms: feeling of worry or dread, feeling tense and jumpy, restlessness or irritability. You get angry quickly. You see like everyone is the cause of your trouble or frustration, isn't it? Yeah, so anticipating worst and being watchful for signs of danger. Yeah? Don't you think sometimes even you're given a ride by someone and you drive like you're holding one side or holding like this because you are worried that maybe an accident will happen and you crash and you die and you know. So what are the physical symptoms? Pounding or racing heart, shortness of breath and difficult breathing, upset stomach, sweating, fatigue, insomnia, where you lack sleep, isn't it? Upset stomach and frequent urination or even sometimes diarrhea. What are sometimes examples of anxiety disorder? Most common are generalized anxiety disorder. We also have panic disorders, we have phobias, we have social and anxiety disorder. Right? What are the symptoms of generalized disorder? Difficult concentrating, difficult controlling the worry, fatigue, exhaustion. You also have irritability, muscle tension, nausea, restlessness, nervousness. You also may have sleep problems. Panic disorder is debilitating anxiety and fear arising frequently and without known reason, but more frequently triggered by fear-producing events or thoughts, often mistaken for a heart attack. A panic attack causes powerful physical symptoms. Panic attacks can last for few seconds to several minutes. Yeah. So what are the symptoms? Agitation. You get angry quickly. Anxiousness. Chest pain. You may have dizziness. Fear or avoidance of places where panic attacks have occurred in the past. It's like, driving somewhere that you have seen occasionally that accident happened at that particular place. most of the time. So when you are driving there, you have the panic attack whereby you start praying and God, I just pray that I'll be able to pass here, isn't it?
Yeah.
So you have fear of dying, feeling of being out of control during panic attack, heart palpitation, hypertension, intense worry about when a next attack will happen, rapid heartbeat, shortness of breath, stomach upset, sudden and repeated attacks of intense fear, tingling. So those are some of the second part of generalized anxiety disorder or panic disorder. Phobias is another example of anxiety disorder, and a phobia is an extreme irrational fear of aversion of a situation. Living creature, place, or being. Most individuals with specific phobias have fear triggers. To avoid panicking,